Mr. President, thank you. I rise today to offer a few comments about the House Republican bill that was just unveiled yesterday. They are claiming in the House, those who have been promoting it or those who have been working on this issue for a couple of weeks, they're claiming it's a new health care plan or a new comprehensive health care proposal. In essence, by their argument, a replacement if the Affordable Care Act were repealed. I disagree. I don't believe in any way it's a plan. It might be a bill, but I think it's a better description of it in terms of its impact would be that it is a scheme, not a plan. It's a scheme that will roll back coverage gains from the Affordable Care Act, better known by a longer name, the Patient Protection and Affordable Care Act. Kaiser, one of the great institutions that tracks healthcare data and healthcare policy, told us that there are 156 million Americans with employer-sponsored coverage. Those Americans didn't have much protection before the Patient Protection and Affordable Care Act with regard to pre-existing conditions or with regard to annual or lifetime limits, a whole series of protections for people that were not there before that. But this scheme, as I'm calling it, will not only roll back coverage gains in the Patient Protection and Affordable Care Act, it will also devastate in the process the Medicaid program, leaving many of the most vulnerable Americans behind. Another impact of this scheme will be to increase costs for middle-class families while cutting taxes for millionaires or multimillionaires, as well as big corporations. It would raise the cost of care for older Americans, and it would substantially cut funding for hospitals in rural communities. So how do we get there, and where are we going, based upon what the House Republican proposal is? Last night, the Republicans released their bill to, quote, replace the Affordable Care Act, and the House Energy and Commerce Committee and the House Ways and Means Committee will be marking up the bill tomorrow. Tomorrow. So it just, I guess it doesn't require much reading to get to a markup tomorrow. Usually when you introduce a bill, the bill is reviewed by members of Congress. There's some public debate about it. There's some back and forth. And then a period of time later, maybe weeks, there's a markup. The committee engages in a thorough review of the bill, and the markup means they just make changes. They add amendments or try to alter the bill in one way or another. So that's a serious approach when you do this work of legislating on a serious issue. Healthcare is about as serious and difficult an issue as there is. I think it should be accorded the serious review that the complexity and the consequence of this issue demands. This is not a serious proposal. It's a scheme, but it's also not a serious process that the House seems to be focused on right now. This process means that the House will mark up this bill within, I guess, about 48 hours of it being unveiled, maybe less than 48 hours. And that means there won't be a single hearing on the bill or getting the bill scored, which is a fancy Washington word for having someone tell us what it costs. So there'll be no thorough review, no serious review on such a monumental issue called health care and what happens to hundreds of millions of Americans. But at the same time, the markup will proceed with lightning speed, and there won't be any information on the record about an analysis of the bill that's thorough and serious, and of course we won't know how to pay for it, or we won't have the score that will tell us how it'll be paid for and what the cost will be. So this bill, it's hard to come up with the words, but it's the impact of it would be a disaster. If you're a millionaire and up, you're doing quite well under this bill. You're going to get a bonanza from this bill. You're going to have a great payday. But if you're a child, or you happen to be a senior, or if you're a woman, or if you're an individual with a disability or a chronic disease, you're out of luck. You're in big trouble. And I would hope that those Americans would have the benefit of a serious review of a serious issue. But if the bill is not serious, then I guess they're going to just ram it through. So we'll see what happens in the next couple of days. But there's one analysis that should be on the record. There are some that are just hot off the presses. This is a report released today that I'm looking at. It's about a little more than about 2.5 pages, because they know that the vote will take place soon in the committee, 2 committees maybe in the House. But so this report by the Center on Budget and Policy Priorities is moving quickly to keep up with the fast pace that the bill is proceeding at. Here's the title of the bill, or the title of the report. I won't read the whole report and won't enter the whole report into the record. I'm sure people can go online and look at it. But here's the title of the report: House GOP Medicaid provisions would shift $370 billion in costs to states over a decade. Written by Edwin Park, who has been writing about Medicaid for a long time. Few Americans know more about Medicaid than Edwin Park and people like him that study it. But here's the first, just one sentence. I'll just read the first sentence, which kind of gives you the basics on it. The new House, and I'm quoting here, the new House Republican health plan would shift an estimated $370 billion, that's with a B, my emphasis, $370 billion in Medicaid costs to states over the next 10 years, effectively ending the Affordable Care Act's Medicaid expansion for 11 million people, while also harming tens of millions of additional seniors, people with disabilities, and children and parents who rely upon Medicaid today, unquote. That's the opening line, the opening summary and opening line of this proposal, which I believe is a scheme. So what does that mean for Medicaid? One of the basic debates we'll have around here is just what happens to Medicaid itself. And we'll have a lot of debates about other aspects of the implications for the Affordable Care Act. But here's what it means. It means that 70 million Americans who rely upon Medicaid, and again, they are children in urban areas, children in rural areas, children in small towns who get their health care from Medicaid. It's a lot of individuals with disabilities, a lot of children with disabilities benefit from Medicaid. It's also, of course, pregnant women, as well as seniors trying to get into a nursing home, because we know that a lot of seniors can't get into a nursing home unless they have the benefits of Medicaid. What the idea is in the bill on Medicaid that is objectionable, among other objections I have, is a so-called per-capita cap. This idea limits federal contributions to a fixed amount, yet the caps are not tied to overall increases in healthcare spending. The net effect is fewer healthcare dollars over time, so they can afford the tax cuts that they want to have as part of this scheme. We've heard a lot around here about flexibility, that states want more flexibility when it comes to Medicaid. Well, I'll tell you what they don't want. They don't want a flexibility argument to be a scheme that results in cuts to those states, where the federal government says, here's a block grant, which may increase or may not, but good luck, states, as you balance your budget. Of course, governors and state legislatures balance their budget, and they have very difficult choices to make, sometimes choices the federal government never makes. So if you're a governor, that's why some Republican governors who took advantage of the Medicaid expansion and expanded health care to a lot of people in their states. That's one of the reasons they're worried about, and some will oppose this idea of so-called per capita caps or block granting of Medicaid or the like. So if we have a proposal to cut $370 billion from the House, what does that mean for some of those groups that I just mentioned earlier? Well, we know that more than 45% of all the births in the United States of America are paid for by Medicaid. So that's a consequence for pregnant women and their children. 1 in 5 seniors receives Medicaid assistance by way of the benefit to someone trying to get into a nursing home. Medicaid also pays for home-based care for seniors, and of course, long-term care as well. How about if you have a disability? Over 1/3 of the nation's adults with disabilities who require extensive services and supports are covered by Medicaid. We know that in a state like mine, because we had both a Republican governor embrace the Medicaid expansion, and then a Democratic governor embrace it and really develop it and bring it to where it is today, we have expansion of Medicaid that resulted in some 700,000, that's not an exact number, but it's approaching 700,000 Pennsylvanians gaining coverage through the Medicaid expansion. 62% of Americans who gained coverage did so through 62% of Americans who gained coverage through the Medicaid expansion are working. So we're talking about a lot of families here and a lot of individuals who are working, and they're getting their health care through Medicaid. And that opportunity presented itself because in the Affordable Care Act, Medicaid was expanded. So there are lots of numbers we could talk about. Maybe I'll just give maybe 2 more. Medicaid is the primary payer for mental health and substance abuse treatment. Medicaid expansion enabled 180,000 Pennsylvanians to receive these life-saving services. So if you're a member of Congress and you've been going home talking about the opioid crisis, and to say it's a crisis is a terrible understatement. It's devastated small towns and rural areas. It's devastated cities. It's destroyed families. We know how bad it is. And some of the numbers indicate that it's getting worse. It's not leveling off. So if you say you care about that and you supported the Comprehensive Addiction and Recovery Act as a member of Congress, and you supported the funding that was in the 21st Century Cures bill at the end of the year, and you say you're working towards help for communities devastated by the opioid crisis, that's okay to say that, but you can't then say, but I want to support the House Republican proposal on Medicaid, when Medicaid is the primary payer for these substance abuse treatment programs. I mentioned before adults and children with disabilities. Medicaid covers 60% of children with disabilities. 60% of children with disabilities. We know the range of that, ranging from autism to Down syndrome to traumatic brain injury and many other disabilities or circumstances that I have not mentioned. So this is, for a lot of people, real life. It's not some theory that gets kicked around Washington, often by people who have good health care coverage, as they're talking about cutting health care for others. We have a lot of testimony from what we might want to call the real world. One of the most compelling pieces of correspondence I've received in my time in the Senate was from a mom about her son. Her name is Pam. She's from Coatesville, Pennsylvania. That's in southeastern Pennsylvania, within the range of Philadelphia, the suburban Philadelphia. She wrote to tell me how important Medicaid is to her family and to tell me about her 5-year-old son, Rowan. She sent me a picture of Rowan with a firefighter's hat on. He, of course, is fascinated, as we all are, by the heroic work of firefighters. Her story, and I won't go through her whole letter, but she got news a couple of years ago that many parents get in the course of the life of their children. She got news in March of 2015 that her son Rowan was diagnosed with autism spectrum disorder. The diagnosis was made by a psychologist who works for the intermediate unit, meaning the institution that works with school districts and helps to provide special education. Rowan continued in the preschool program and daycare program before and after school, but then Pam goes on to say, quote, "I was never able to find a daycare suitable for all of Rowan's needs. In late January of 2016, I applied for medical assistance." I'll stop there for a moment to explain. Medical assistance is the state share, the state end of the Medicaid program. We call it medical assistance. In other states, they have a different name for it. But Pam said she applied for medical assistance. I'm quoting again. "After Rowan was awarded this assistance, we were able to obtain wraparound services, which included a behavioral specialist consultant and a therapeutic staff support worker." Pam goes on to say that, and I'm quoting her again, "Without medical assistance, I'm confident that I could not work full-time to support our family. We would be bankrupt, and my son would go without the therapies he needs," unquote. Those are the therapies I just mentioned. Then Pam goes on to say, urging me as one of her two senators, to focus on her son, focus on her family when we're casting votes and having debates about policy as it relates to health care or Medicaid. So here's what Pam asked me to do as her senator, quote, "Please think of Rowan, my son. Please think of my 9-month-old Luna, who's Rowan's sister, who smiles and laughs at her brother. She will have to care for Rowan late in her life after we are gone. We are desperately in need of Rowan's medical assistance and would be devastated if we lost these benefits," unquote. So said Pam about her son and about the importance of the medical assistance program, which is known on the national level as Medicaid. So I would hope that those in the House, as they're quickly marking up legislation that would have a huge impact on families like Pam's and many, many more, I would hope that they would think of Rowan, think of his little sister Luna, what her challenges might be years from now when she would likely have to care for Rowan, and answer some of Pam's questions. There are a lot of questions that we have about policy and numbers and budget impact, and they're all appropriate. But some of the most important questions we have to answer for those who are asking them are questions that our constituents are asking. And one of those is Pam. We've got to be responsive to her concerns about her son and the challenges her son faces. So I would hope that in the midst of debate, in the midst of very rapid consideration of a complicated subject in a bill that's been slapped together, in my judgment, too quickly, I would hope that Pam's concerns would be uppermost and would be a priority in the minds of those who are working on this legislation. Mr. President, I would yield the floor and note the absence of a quorum.